Good morning. It's that time again. Right, for those of you that haven't watched me before, and there's not enough of you that haven't watched me before, about 6-7 months ago, I was diagnosed with advanced metastatic prostate cancer. And I started these, what I call plugs, prostate logs, to try and help any of you that are suffering. Also to basically communicate with the family, and also to leave a lasting log for family members to watch in the event I do, pass on. Basically I found out since I got 6 tumours, 4 in my spine, which was 3 just at my shoulder blades, 1 at the top of my pelvis, and then 2 in my pelvic lymph nodes either side of the prostate, as well as the tumour that was inside the prostate. Too many to operate, too many to treat with radiation. So I entered into a 3-way attack. First generation testosterone tablets, second generation, and chemo. So that basically brings up to date. I finished chemo about must be about 8 weeks ago now. So I'm just trying to recover from all the after effects. I'm due to go and see my oncologist in about 3 weeks' time, beginning of December, at which point I'll do another plug for you to find out what's happening. Yesterday I went for my bone scan, more commonly known as a SPECT, SPECT, CT. And basically what they do is that they inject you with a radioactive element, hence the short I did and posted before this one. There's a bit of a laugh. So I do a lot of that, saying yes. It just gives me a bit of thinking time, because I don't have any prepared documents. I don't have any sort of written things down. I suppose I should really, but I like to talk just off the cuff, so to speak, or off the prostate. So I went for me. They inject you with the radioactive element, and according to the nurse, I'll not mention your name. I wish I'm sort of almost saying it. We had a lovely chat, a right good old laugh together, and I came out and I thought, what were we talking about? Because she was telling me funny occurrences of her children and things, and I was sort of passing on. It's all right, we've got these starlings all flying around. They're doing that sort of pattern in the sky. And they keep flying around in the field next to the house. So they catch the corner of my eye, and I can't help but look because it's such a spectacular sight. Anyway, sorry. You see, I tend to rattle on and just mumble on about things. Yes, what she explained, which is most interesting, she was very good at it, is that this radioactive element is naturally attracted to new calcium. In other words, calcium that's building bones. So she says if you've got any spinal damage, between your sort of spine vertebrae, she says it'll show up. She says, and naturally, your bones around your body, there are some bones that are always building bone structure. She says, so it tends to go to those areas, and it shows up on the scan, and they're able to work out how your bone structure is going and they're flying around again. Wish I could show you. Yeah, it indicates to them how your skeletal structure is going. Oh, do you like me hair? Oh, and I've got patterning on the side. It's beginning to grow, and I'm getting my beard back. There's about 3 months growth there. It's hardly growing at all. Same with hair. That's like 6 months worth, and it's about an inch, if that. My grandson, when he saw that, he says, "Oh, cool, Grandad." So, and it's all part of my colourful tapestry. I've always had the same sort of hairstyle ever since I can remember. My dad used to cut it, and I've always sort of continued on with that style. And I've never been radical. I mean, I had it down here when I was younger, but, you know, in my late teens and that, I had very long hair. Anyway, so this is me radical self coming out, you know, right? And so it's been shaved right close. And, you know, it's like running your hand up a sandpaper. And I said to her, go to town, use your artistic nature, crack on and put some patterns. So that's what she's done. Yeah. So and I think that's what started the discussion with the nurse. Because she says, "Oh, you've got patterning on your hair." So, you know, that started the ball rolling. So I told her about this, so I hope you're watching, because I'm gonna see you. I'm gonna find out what you think. Anyway, the reason for the bone scan is that because of these first and second generation tablets that take all the testosterone away, without testosterone in your body, it stops building bones. So they are very concerned about your skeletal strength long term. So they have to monitor it. And so this scan yesterday is the first one I've had. And basically it's the baseline. So they'll be doing future ones, I don't know how often, probably every year. And they'll be watching my skeleton and making sure that it keeps its strength. Because I'm doing all these exercises or trying to keep me sort of strength up. And it's coming back very slowly, but it's not a patch on what I used to be. Yeah, so the scan, basically, they inject you with this fluid, radioactive fluid, and then you've got to go away for 3 hours and come back. I'm just checking time. And the machine, it's like a big X-ray machine. There was 3 sections. And she was very good in getting your comfort. And what they do is they put this like strap, and it's about this wide, and they put it round your arms, so your arms are held at the side of your body. And she says, keep your hands in because the machine gets that close. And then because your feet naturally sort of do that, they have an elastic loop, and they fasten it around your shoes, and you go bump, and your shoes come together to keep your feet straight up. You know, all very good. And so she says, have you had one of... So, no, I've not had one of these before, but I've been in plenty of tight spots, so I'm not... I haven't got any problems with enclosed spaces. Chemo brain. Yeah, so this machine starts, and of course it goes... And it's like the X-ray pad comes down, and it sits, and of course it's down completely over your face, and it sits, and it's probably about a quarter of an inch, maybe eighth of an inch off your nose. So it's the strangest feeling, you know, this great big machine sat there right up against your nose. But of course they're getting as close as possible to get the best definition. And then it moves down in sections down your body. But the next sections, it's been up here. It then moves down, and it's literally at my chin, and it's rubbing my whiskers. And they're not that long, And I'm thinking, oh dear. So that was the first one. She says that lasted 15 minutes. Then she came in and she says, this next one will last, 20 minutes, I think she said. Yeah, 10 minutes each. And what it does is you've got the transmitter and you've got the receiver of the X-ray, and basically it comes right close to you again. And what it does then is it does this, and it's probably about 5 degrees, so you've got like 70 odd of these sort of movements, and it does one complete circle, and then it moves down. She says the first one is sort of from here down to mid body, and then the next one is sort of down to tops of your legs to get your pelvis. So it's like 20 minutes, and you lay there, and of course all you've got is this zzz, as it moves, and then it's sort of fairly quiet, and then you go zzz, again. So you just lay there, and your mind's drifting away, and next thing I know, I'm thinking, bloody hell, I was nodding off, literally, because you know your brain starts to go into that fuzzy world of, you know, thoughts, and then you suddenly click out these thoughts and think, bloody hell, I was nodding away there. And she came back afterwards, and she said, or I said to her, I think I was nodding off then. She said, oh, you're not the first. She says, we've had plenty of them. So then she says, this next one, she says, it's going to be a lot noisier. And she says it's going to vibrate more, the table. It's all right, the dog's looking. Come here, Blue. Come here. Ian, come here then. Say hello to all the viewers. Oh, let's have a look. Oh, now look. Who's that? Who's that? Don't start barking. No. Oh, Cocker Spaniel's renowned for barking. He's a good boy. Keeps me happy. Oh, he's seen the birds. Hey, Blue, no, shh. Put your collar on. Where's your collar? We've got one of these collars that beeps. Yeah, right, so the third and final one, she says this on, no, Blue, he's sniffing up at the camera. She says it only lasts for sort of 10 minutes, but it's a lot more violent. So what this machine does then is it goes and it moves right up, and it's like you can see the last panels and you can see all the workings and things. You know what's going on here? So it goes all the way up and then it comes back down again. Don't know what it were doing. But then you go, and you think, bloody hell, it's going to take off. And this thing is spinning round. And it's like a big washing machine drum. And you're inside the bloody drum going round. Because what it does, it passes over, and you see it's whizzing around this thing. And I'm thinking, Christ, it's a time machine. I'm going back in time. I'm going to see Cocky Bennett, and I'm going to piss over toilet walls at school again. So I thought, any minute now it's going to start going blue sparks and things, you know, like Marty McFly's Back to the Future car, you know. I thought, any minute now all these sparks are going to start going off, and I'm going to go boosh, ball of flames, and I'll come shooting out this tunnel, you know, all sort of covered in frost and sort of steaming, you know. So my imagination. So anyway, it does all this sort of spinning, and it finishes that, and that was the end of it. So, but oh dear. Right, so basically I find the results out in about 3 weeks' time, beginning of December, when I see my consultant. And I should have another PSA then, because I'm going for bloods 5 days before I see the consultant. The other thing Now, if you remember in the previous ones, I was talking about baby bears, mummy bears, daddy bears. I was watching a lecture. It was about an hour and a half, so a bit dry. But it was talking about second generation hormonal therapies or whatever they call it. I can't remember. Hormone deprivation therapy. I think they were talking about, and they were talking about the second generation or development of the second generation medications, and when they were going through the trials, excuse me, and what they said is that people should be aware that cardiovascular issues are significant with second generation medication. And what they were saying was that, I think he said back in the 90s when they were actually doing the initial stage trials to get these meds approved for second generation hormonal treatment. Now, if you remember, second generation attacked the mummy bears, the ones that are generating their own testosterone. And what happened was that, of course, they didn't know to take account of people with cardiovascular, heart attacks, in other words, or stroke risk. So they just picked this natural group and then start the trials. And something like 25% of them dropped dead. And they thought, oh dear God, we'll have to stop the trial. And they then realised that I think it's significant something events or something, the way that they termed it, they realised that they've got to filter out these groups of people that had cardiovascular issues, and they couldn't use these drugs on them. So then they used this selected group, and of course it all worked, and it got approved. So what he said was that anybody with a cardiovascular issue, and I'm saying this so that, I'm putting it into layman's terms so that you as a sufferer who's watching this learns what I've learnt, is that there is something like a 25% higher risk of you having a heart attack or a stroke when you are on second generation medication. I haven't counted. Probably about 10 o'clock, I think. Yeah, so now, of course, I've never had a heart attack or a stroke, but I've suffered with AF, which I think I told you about, and I've had all these cardioversions and things in the past. So my doctor originally did an assessment of me and said that I had, I think it was an 18 or 20% risk of having a stroke and, potential life-threatening event. So effectively, now I knew this when I was going on to second generation, effectively it puts my risk up to about 40 or 50% risk of a heart attack. So, and I joked with my oncologist back in 6 months ago. I said, I don't know which is going to get me first, the tumours or have a heart attack. Now, and that's one of the reasons that I went on Orgovix, or regular Licks, is that it has a much lesser impact on your cardiovascular issues. And it's a reduced risk by 50% from the other tablets. So it halves its effect on your cardiovascular system. So, if you are a heart attack sufferer and you've got prostate cancer, then be aware, discuss it with your oncologist. What was the other thing I was going to mention about? Oh, blimey. Oh, dear. Pregnant pause while I think. Yeah, there was something else around. Oh dear. Oh yes, it's come back. As you know, I watch the Prostate Cancer Research Institute YouTube site. Dr. Schultz, the guy with all the colourful ties. There's one, one member keeps pointing out to me, "Oh, you mean the guy with the colourful ties?" And he's brilliant. He's American, so it's all Americanised. And this was covering something I was talking about a couple of days ago. He's just done a newish YouTube video discussing this subject about men like me who have been diagnosed, have just turned up and have got basically metastatic advanced Gleason 9. Well, it's saying Gleason, so 8 and above. Tumours, sufficient tumours that there's not much you can do. And you remember I was talking about the PSA nadir. I keep forgetting that word. Yeah, he's done this thing where he said about 50%. He says what is most crucial is that you get your PSA below 0.1 within that first 6 months. He says if you can achieve that, or if you achieve that, he says in my clinic, he says 50% of the men that come in, he says get it below 0.1 within the 6 months. And he says, and he says there are some of those men that go on and are cured. He says what I mean by cured, he says, is that we can the PSA drops so low it's undetectable, and it stays undetectable. He says we take them off the first and second generation testosterone tablets. He says the PSA remains low. He says, and I've had some men that he says they've been like that for 10 years, cured, total remission. He says we get some men, he says, where we keep them on first and second generation, which is probably going to be me, I guess. And he says, but the PSA never rises again. So in other words, they've got no daddy bears. So it was so reassuring, and he was criticising my oncologist quite bad, because he said, well, he was asked a question about sort of prognosis of these men. He says, I'm not prepared to enter into that. He says, because it's an individual thing. He says, and I can't give a general rule. He says, because there isn't a general rule. He says, and any oncologist who gives any patient a prognosis and says, oh, you've only got 1, 3, 5, 8 years left to live or whatever, he says, it's wrong. He shouldn't be doing it. He says, it's natural that they'll try and do that because they want to, show that they are professional and give advice. He says, but effectively, he says, you can't do it. He says, because it's so individual. And he says, the chances are you're going to be wrong anyway. He says, and any oncologist who right at the start gives you a prognosis and says, oh, you've got so long to live, he says he doesn't know what he's talking about. He says he's wrong. He should not do it. And that's exactly what my Irish Einstein oncologist said. He gave me 5 years. He says, oh, but you'll exceed that, Well, listening to, Dr. Schultz, and he's not a quack. He's an oncologist he does just prostate. So basically, most reassuring. I was buoyed up no end. So right, I think that's not so many laughs, I don't think, this time. So I'll probably post this tomorrow, just to give people a chance to absorb the short, the blue one. It's actually ultraviolet that makes it all, you know, the thing that makes white sort of glow in the dark. Right, okay. Yeah, Life Rich Tapestry. I've given myself a bit of a colourful tapestry. Somewhat different, somewhat new in life, you know. Yeah, I mean, there's other things going off, but family will know about them, but I'm not gonna discuss them on here, really. But fingers crossed. Yeah. Right. Okay. It's 26 minutes just gone. I don't know, why is it that my numbers aren't going up? Don't people like me? Am I ugly? Hey, aren't I handsome enough for people to subscribe and like and, you know, notification bell, ding ding, as I say. Yeah, so anyway, if you're watching this for the first time, and this is what I said to the nurse, I says, you've got to subscribe, go right back 7 months ago to when I started it. I said, because that sets out, you know, Cocky Bennett, peeing over the wall, all those sorts of things. Oh, and by the way, YouTube actually removed one of my videos because I was talking about all my experiences with, I don't know if I should say this because they might remove this one, but about the railways and things and what happened with different people and, you know, all my life's experiences. And I did one on that, and Peter basically came on and said, remind me never to go on a train journey with you. So, anyway, but YouTube didn't like it. Must have had a complaint or something from somebody. Yeah, so anyway, it's, you know, if people don't like it, fair enough. Right. I can't think much else to say. So it might be a couple of weeks before you get another one. I mean, if things occur, if I think there's sufficient meat to be able to talk it through with you, I'll do one. Yeah, your health is your responsibility. Make sure you push for the best treatment possible and find out, read up on it, whatever. And life is a rich tapestry. I mean, I'm probably enjoying it more now than I have done in years, just purely and simply because there's not much time left, potentially. Might have another 8-10 years yet, who knows? So I'm going to make the bleeding best of it. So so like I said to the nurse, I says, I'm going to enjoy it, I'm going to have a laugh, joke, you know. I says, and it makes your life better and it makes my life better because it helps me and it helps them. And she agreed. Right, and it was good to meet you. Yeah, nice little chat. And I was telling her about the phlebotomist, which I've told you about a couple of sessions ago. Right, it's just coming up half an hour. I think that's long enough. I should make them shorter. People might watch more then. Right, okay, love you all, and whether I know you or not, hugs and kisses and all that. Bye now.